Hi, everybody. If you do not want to be in Caregiver 1, you should leave now. So our first speaker today is going to be Nancy Knitter. Nancy is currently on the Michigan Parkinson's Foundation Board of Directors and is the co-facilitator of the Rochester Parkinson's Support Group. She has organized a care partner support group, a breakfast club, and has stimulated and maintained an exercise program with Dr. Blatt, who I hope you got to see, and Dance for Parkinson's with Ali Werner at Oakland University. A woman of many talents, she is also active in many other community activities, including writing. Nancy's husband, Harry, had Parkinson's and was one of the first people to have DBS. Together, they traveled the state and beyond, lecturing and promoting their books, including Never Give Up, about Harry's experience with DBS. A gem, she helps many people with PD and their care partners with her background and expert advice. Let's welcome Nancy.
I obviously didn't write that. Thank you all for being here. There's obviously a big need to help you people that are caregivers, care partners, however you refer to yourself. I'll just tell you very briefly, my husband had Parkinson's for 20 years. He was diagnosed at 55 and passed at 75 about 5 years ago. As Laura said, he was one of the first people to have DBS in Michigan after it was just, in fact, it hadn't been officially approved by the FDA. He was still in the clinical trials, and it was quite successful for him. But I think, as we say, we're going to call ourselves maybe at the beginning part of this. Yes? Tell people about the cards. Oh, yes. Anyway, cards on the table are for any questions that might come to mind, and we'll try to get to as many as we can, because I know there are a lot of people here. So you all have different needs as care partners, caregivers. So, we just hope that we're just, between these two sessions, giving you kind of a broad spectrum of different things that can be helpful to you. So my real purpose this afternoon is to do the phases of caregiving, and this I kind of developed as I look back after my caregiver years were over, just how this all evolved over the 20 years and how it could be helpful in planning for anyone else that's a care partner / caregiver. So I would just like to have you follow along, and as I said, if you do have a question, something brief that we can address, I don't mind being interrupted, but we are in a time limit so that we get through. The phase 1, okay, you've got this wonderful diagnosis, and as I'm sure all of you can remember the day when you found out that your spouse or loved one was diagnosed with Parkinson's. Maybe it was something you suspected along the way, or it was, as in our case, something that came out of the clear blue. My husband said after he was told by his neurologist that he had Parkinson's disease, he said, the doctor could have just as well told me I was pregnant. He said that's how foreign it was. What? He didn't even really know what Parkinson's disease was, and we did not have it in our family. So you come out of that office and things are swirling in your mind, and you're just trying to get over that diagnosis, the words that come out of the doctor's mouth, and okay, what is this disease, and what are we looking forward to? So it's not always an easy thing to do, but the best thing is to sit down with your loved one and try to just talk about the situation. What do you think is happening? What do you think we might be facing together? And what do we know about this disease? Probably not a whole lot, unless you happen to be have another family member that's had Parkinson's or a friend that's had Parkinson's. Most of us have only seen, people on TV that we know, like Michael J. Fox, for instance. So, there's a whole lot that needs to be learned. So the thing you really need to do is how much do you really know about this disease? Most people will say, well, as in my husband's case, he never had a tremor, so that's why he said it was out of the clear blue. He said, oh, I don't have Parkinson's, I don't have a tremor. Not everybody that has Parkinson's has tremors. So that's one of the things you have to see. How can you go together with this? That's where you're really care partners now. You both have the input. How do you proceed together? How are we going to face this diagnosis? And as I said, perhaps even with the physician, you're not even put on drugs right away, depending where you are with the Parkinson's or if you're having difficulties. So there might not be much of a change. So right now, that's the phase where you're just going to go ahead and kind of just proceed, but that doesn't mean you have to let everything go. Another thing that you probably should do once you get a little bit more at ease with the fact that you have this disease after finding out more about it, definitely. We made this mistake. We'd held it from our family for quite a while, family and friends, because we didn't feel we wanted to put that burden upon them. But I would, in retrospect, as I look back, I would say I would have done the opposite. I would have sat down and had a family gathering and talked to them, because they're on this journey with you too. It's not just the spouse and the person with Parkinson's, it's the whole family. So I think if you can have just a family gathering and talk about this diagnosis and what you know about it so far. I think as on this PowerPoint, I would kind of reverse a few things. I would say get as much information as you can first about the disease. There's so much out there, actually. 25 years ago, that wasn't true. Most of the books that I was able to access were very medically oriented, and trying to get through the medical verbiage was very difficult. And I even recall going to a meeting with a specialist, and he had this wonderful little red pointer, and he had one of those wonderful graphs with the brain, and all the different sections of the brain, and all he did was kept going like this, and by the time we were through watching that, we were, kind of mesmerized by this red light that was going around, and really didn't learn too much. But these days there's so much online and information, and of course, I can't tell you how much it means to have the Michigan Parkinson Foundation in your corner. They are a bit like a lifeline for you, because you can go to them and they will always help you in doing seminars and symposiums like we have today, and also the support groups in so many parts of the state. So they're running these newly diagnosed meetings. They're usually at the main office, but there are in other parts of the state too. So you need to get information more than anything else, just to understand what this disease is and what it's all about. So then you work into, say, many times people are still working, and so you need to think, well, when do I tell my employer that I have this condition? And that's something you'll have to talk to the family about. And I think it depends on the employer, whether you're a large company or a small company. Sometimes it helps to seek professional advice on this, and there are some lawyers who will deal with helping you out because of disability, etc. That I think you really need to have some professional advice on, because most people do not understand Parkinson's. And with Parkinson's, it's not only a tremor or slowness, but sometimes it changes personality to some degree. And so an employer might see a very different change and not really understand it. So that's when you have to consult with the family, perhaps get some professional advice, and then sit down with your employer or your, what they call them, the human resources person, etc., and talk about that, because it's extremely important. Okay, you've gotten through that first phase. Now, I'm not saying how long these take. This could take weeks, months, maybe years for that matter, because as you know, Parkinson's progresses very differently for everybody. So, as I said, phase 1 might be very short, or it might be a longer period of time. So now it's time to start really working on making a plan. Sometimes the person with Parkinson's starts having more needs. There's more demands on you as a caregiver, particularly. And so this is when you have to decide what you can do to help or what they can do. We have to, as a care partner, how many people have this, they want to jump in and do it for their person with Parkinson's? We have to learn that there's a timing element here. Things slow down in many, many ways. So you have to increase your patience. That always was my mantra. Patience, patience, dear Lord, give me patience for the day. Because it is difficult when you see the person you love struggling with a button or even cutting food, etc., and you want to just jump in and help. But you have to give them that feeling of dignity and that things are still going to be fine. They just need a little bit more time to do it. So we have to slow our inclination to jump into to help a little bit, hold it back, and let the person with Parkinson's still do as much as they can, no matter how slow it takes them. Might take them 2 hours to get dressed in the morning, but if they can still do it, let them do it. Another thing is perhaps keep a plan. And I think a diary is really important before you go to your doctor's appointments, because you only see the doctor, say, for half an hour, and he only sees you once, usually the specialist, once every 3 to 6 months. So he doesn't see what you're dealing with or the person with Parkinson's is all the other times where you're living with that person 24/7. So it's very good to take notes, perhaps even put down any fluctuations in medication or side effects of medication so that you have that already in hand to ask your doctor, because it helps him, the doctor, he or she, know how to manage your medications. And it's an individual thing. There's no, everybody that has Parkinson's is going to take Cinemet 4 times a day, da-da-da-da-da-da. That's not how it works. Everybody is evaluated separately, and everybody has a different management plan for their Parkinson's. So it's really important to keep notes in a diary particularly. Planning financially, I guess these days we all are told to make our plans, unlike I hear Prince. Can you believe that? Didn't have a will. That seems strange to me. But making the plans for the financial is something because you want to know what to do together. You want to make your plans together. And so it's not something that you face too quickly or unexpectedly and then have to make some very decisions that might be kind of insensitive to other people. So I think that's very important. And there are many elder law attorneys that really deal with some of the ins and outs of this type of situation, especially people with disabilities. So I would highly recommend, yes, they do cost money, but I'll tell you they're worth usually every penny that they charge, because it puts you at ease in your decisions as you go. Okay, things have been going pretty swimmingly most of the time. You try and do everything you can. You encourage the person with Parkinson's. Okay, if you were a golfer, you can still golf. Might take you longer. Maybe you want to keep it to 9 holes instead of 18 holes. If you play tennis, okay, maybe you'll want to play doubles instead of singles so that you can handle the running. Perhaps you like to play ball with the grandkids. That I think grandkids are the most accepting group of people. They're more than happy to throw the ball with their grandparents particularly. And they don't care if you catch it or throw it funny. they'll go do it anyway. So continue doing anything you can. You may have to adapt in many ways to, different ways of doing things, but do not give it up. Do not give it up. So now it's all on your shoulders. Things have progressed maybe, not always, as I'm saying, not for everybody, but it's all on your shoulders now, the caregiver's shoulders. Here you are. You have to take over perhaps the finances. Perhaps you have to take over all the medication management because they're not able to keep track of their medications and do it on their own. Perhaps you have to do all the driving because driving is no longer an option for the person with Parkinson's. You are taking on a lot. And were you trained for this? No. Nobody was trained for this particularly. It's kind of dumped in your lap, and you have to deal with it. But you are strong. Believe it or not, caregivers are very strong people. They get through it. Sometimes there are days when you say, hey, I just can't go on anymore. But then take a deep breath and you say, well, just get me through this day. If I get through this day, maybe I can make it through another day. And that usually does happen. Many times, unfortunately, dementia comes into the picture, especially people who are older when they're diagnosed with Parkinson's. And as they get older, there's dementia that many times is in the picture. And that's the hardest thing to deal with, because then you see a real change in not only the thinking, but perhaps even that person that you loved for so many years doesn't seem like the same person anymore. You've lost that person. In a way, you've sort of gone through a bit of a grieving process all along the way because you're losing a little bit of them all the time. So you have to learn how to work with a person that has cognition problems. And as I said, of course, the patience is, number one up there. But you can do it. You can work out a program. You can work out little, not tricks, but different things that you do to help the person with dementia. And I'm not going into any specifics, but you can get a lot of help in support groups from this. One of the very things just to throw out is we always had a huge calendar on the wall, a large one, so that we would write in what was happening on that day, so that it was there and easy to read. And so when the person, like my husband, get confused as to what day it was or what we were going to do, I would just say, look at the calendar and let's take a look at what we have going for today. And that was very helpful. So visual cues are usually very good to use with the person with Parkinson's. You have to assess your situation. I think what always worked well for me is making a list, because I'm a visual person, and when I write it down, I remember it a lot easier. Make a list as to, okay, here I am. I have all the burden on my shoulders. What do I need help with? And believe me, you need help. So you can list what you can handle and what you can't handle, and what maybe some family and friends can help with. And you know how many times people will come up to you and say, oh, what can I help you with? And you'll say, oh, there's nothing, I'm doing fine. Keep something up there and say, well, if you don't mind, I'll call you. Sometimes I need someone just to come in for an hour to stay with my loved one so I can run and pick up the medications at the drugstore, or I can go, get my hair cut, that type of a thing. It's short, it's very easy, it's something people will probably never say no to. So take advantage of that. And I know it's not in our nature because we want to be independent, we want to think we can handle it all. But start with those little things because you do need help. And then, of course, when things really do progress, you may have to look into some agencies that will help with home care, perhaps adult daycare. And there are a number of agencies, many, many more now than there ever have been. And of course, the big one to go to for getting information is the Area Agency on Aging. They are extremely helpful. And of course, the Michigan Parkinson Foundation will direct you also. Paula's going to talk a lot more about advocacy, but you do have to be an advocate not only for yourself, but for the person with Parkinson's, especially when it comes to patient care and when they have to visit the hospital or nursing care facility. There are still big issues with the timing of medication, which don't seem to get delivered, and you have to know how to work with those people in getting that done. When you can work also with a social worker if at the hospital or rehab facilities, take advantage of their knowledge and their expertise. They are a wealth of information because they deal with these situations every day. Have info on the medications. You come to symposiums like here and find out what kind of care that you want to share that with the physicians, the nurses, and the therapists. What can you expect? What kind of care can you expect for your loved one? Now, through all these phases, we come to what about you as a person? Because you will be impacted physically and emotionally. So you have to take care of yourself first. It's sort of like being in the airplane, and they always say if something happens and the masks come down and you have a child in your lap, put it on yourself first. Then because you're the one that has to supervise and continue things and then take care of things. So it's important. You don't help the person with Parkinson's by getting ill yourself. So and many times you put off going to the doctor for your physicals because you're going to the doctor all the time with the person with Parkinson's. So don't put yourself aside. You have to be in the best shape you can. And be open about your feelings. You will feel anger, impatience, and depression. And you can get help for all of that, especially depression. Don't let that drag you down. There's help for being depressed. The feelings of anger are very natural. I can't tell you how many times I would scream and yell, and not very nice sometimes because he wasn't moving fast enough. He wasn't getting dressed fast enough, or he'd do something kind of strange. But we never went to bed angry. I would say, give him a big hug and kiss at night, and I'd say, I'm sorry if I was really goofy today and let my anger get away from me, but it's not you I'm angry with. I'm angry at this disease. And most times he understood, he knew. He said anyone would feel that way. So keep that dialogue going, keep that love going, because as you know, people with Parkinson's sometimes draw back, or they look like they're apathetic and don't have a whole lot of expression on it. It doesn't mean they're not feeling anything. They really do feel. And you keep that going, that dialogue, that even if it's not words, at least expression of love with each other. You need to do that. So you can't do this job alone. You have to keep connected. Don't draw back and not visit anymore. Don't, if your friends maybe aren't around as much, maybe you can just have them come for a small gathering, because usually something with too many people has a tendency to be difficult to deal with for the person with Parkinson's. And now, after all of these, there's a big word that I didn't put on here, but what you have to do is exercise. Exercise, exercise, exercise. Not only for the person with Parkinson's, the caregiver, because exercise is uplifting, it makes you feel better, and it's good for your whole well-being. So please do some exercise. If you can't get out to a class, do something at home that will give you some movement and make you feel good. Take a walk. You can always take a walk. And if you need time for yourself, make time for yourself. I had a little space in the den or office. That was mine. That was my space. And so after late in the evening, I'd go over, and that was my time to work on the computer or whatever. And on Friday nights, that was party night for me. party night for me. He'd go to bed around 9, and I would bring out the glass of wine and some cheese and watch whatever I wanted on TV. So this is what you have to do for yourself, and we know that you can get through it. Day by day, as I said, you will make it. You are all very strong people. You really are. And I just I won't go through the resources, but they're at the back of this PowerPoint, and I'm sure there are many, many more. And there are a lot of good books out there that are very helpful. And so I encourage you to feel good about yourself and love your person with Parkinson's. They love you. They might not show it very often, but they do. And so keep that connection going and pat yourself on the back every single day. So take care. You want to put that on here?
If you have questions, go ahead and write them on the index cards, and we'll collect them all and try to answer everybody's questions, hopefully. Nancy? Karen, can you come up? Yeah. Maybe Karen can introduce you while I switch this out.
Yeah. Actually, we were just,
No, we need that. Here we go. Yeah, go ahead and introduce her while I get this up.
Hello, everybody. So our next speaker is Paula Gibson.
Oh, it's Gibeson, sorry.
It's Gibeson. Paula Gibson, who is an RN, and she's the former resource clinician for Munson's Geriatric Assessment Center clinic. She offers education for senior citizens and their caregivers. And for 20 years, you've got quite a history there, she performed health assessments for individuals in their homes and coordinated the multidisciplinary team, including physicians, pharmacists, social workers, and psychologists. Promoting dignity and safety of senior citizens has always been her goal. So additionally, Paula coordinated a satellite office for the Michigan Alzheimer's Disease Research Clinic for the University of Michigan. And she is certified as a gerontological nurse from the American Nurses Credentialing Center. It's a really big deal. Paula has authored a practical health and safety guide called Golden Independence through Infinity Publishing, and it is on Amazon.com.
Thank you. All right. Thank you. Especially thanks to both Laura and Karen for helping us move right along here. And Nancy, very well said. Obviously things that we need to think about and hear about. And I'm going to talk about the word advocate, and that means an advocacy or advocating, however the word comes out and everything. But I do want to make it really clear, because I respect the fact that when we're dealing with Parkinson's, there may be someone with Parkinson's who is their own advocate, or there may be an advocate who is advocating on behalf of someone else. So as I talk, I may not always sound like I'm talking to both sets of people, but I really am. So I don't want to downplay the fact that someone has to have an advocate for someone else. You may very well be your own advocate, but the applications all still apply, okay? And for starters, too, I just want to kind of belabor a little bit of a point that Nancy made, as far as that, care partners, if you're caring for yourself or whatever, it's really hard to do it all. And if you know what a metronome is, perhaps we can know what it goes on, inside the mind of a care partner trying to do it all. Bing, 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 yes. Or sometimes the mind of a care partner who is talking to a nurse who has no idea about medications and Parkinson's. Okay, but advocacy is more like Mozart. It's all about keeping things in timing. It doesn't mean doing it all. It doesn't mean stepping back and doing nothing. It means getting things settled down together with, you're going to hear the word team a lot, because I like acronyms to help people remember what I'm saying. So hopefully if you don't remember me or whatever, you can remember the word team, because here for starters, I want to talk about who are the members of the team. So like I said, the team is the team leader. It might be the person with Parkinson's, might be the spouse, might be daughter, might be daughter-in-law. I've seen many daughters-in-law who take over the responsibility of caring. Or in some cases, there are case managers. Some insurance companies offer a case manager. I suggest the advocate needs to learn a new word in the vocabulary, and the word is yes. So often, people don't realize that kids learn the word no very soon, but not the word yes. And you know that human nature is the same if you're 2 or if you're 92, anywhere in between. So learning the word yes, if you have a chance to have a case manager to help with the advocacy role, that's okay. You're not any less of a person. You're still the care partner. You're still taking care of yourself. But case managers can be very helpful. And when you're thinking about members of the team, so that means getting through the week, getting through the day with Parkinson's, getting through the next 90 minutes, okay? That could mean the physician, all the physicians you're tending to, not only the primary care doctor and neurologist, but there may be a urologist and a cardiologist involved, and they all have to be in sync with each other. Nurses, if you are dependent on going into an emergency room, it's very important there that they recognize they have a responsibility to the whole person and not just the knee injury that they're in the room for. So, and understanding all the other therapies that are involved, physical therapists, pharmacists, etc., everybody is a member of the team. So why am I talking about team? Okay, we need to be in sync just like a metronome. And to remember the word team, T starts with trust. You know, if you can't trust someone to meet your person's need, how can you even leave the building knowing they're probably not going to get their meds on time? And if you can't trust them, as an advocate, it's your job to make sure that they know you're not trustworthy. If a nurse is not doing the medications on time, it's okay, actually, it's needed to tell them, we need to be able to trust you. And there again, everyone needs to be involved. If the forefront of people are not providing the needs, the very basic needs, then you need to either go above them and notify whoever their superior is, or in writing or whatever it needs to happen, to not simply let it go. There's a lot of education that needs to go on to general healthcare workers about the unique needs of Parkinson's, and that we can start right now with us. And assessing what the situation is what the letter A stands for. And I don't need to describe that for you, because from minute to minute, when is their next appointment? What needs to happen next? Are they frozen now? What's going to happen if we get there and they freeze? What's going to happen after that? So assessing, it goes on and on from every hour to hour. And the M is messenger, learning and talking about communicating. And we're going to talk about communicating in a little bit more detail as well. So looking at what goals are we talking about? And actually, as I have listed off, the first 3 things are the same thing. You want the person with Parkinson's, be it yourself or your loved one, you want to have the most on time. Why? Because then a person can do as much for themselves as possible and support their dignity. Dignity is vital. Parkinson's tends to take away a person's dignity, and the advocate needs to do all that they can to support that dignity, speaking up for that person. If a person just can't speak for themselves, then you are the voice, and that means assuring that all the team members communicate with each other and communicate knowing what it is that the unique needs are. And we're going to talk more about that in just a couple minutes. Okay, so as we're doing with communicating with healthcare workers, okay, question for you. A lot of people have a medication list that they carry with them, and I would like to see everybody's hand in the air saying, oh yeah, I do that, right? Oh, bad group, bad. I'm going to get the metronome out again. Anyway, okay, so you do need to have a medication list with you all the time, because most car accidents are not scheduled, okay? And you never know if someone's going to get sick. You never know if you're going to be away from home and something's going to happen. So you need to maintain a medication list, but it's a different list if you have someone with Parkinson's. Why? Well, I help out at a doctor's office, and they come in with a list of what medications, and I realize some people don't even write what dosages down. Well, with Parkinson's, a lot of times medications are being changed, dose, tweak, this, whatever. We need to know today what the dosage is that they're taking. And you know what else needs to be on that list? The times. I was consulting with an assisted living recently, and they said, okay, we have someone that was just admitted with Parkinson's and was wondering if you could help us with that. And I said, okay, let me look at his medications. And he was on Cinnamate 7 times a day. Well, that's not so rare. And they looked at me cross-eyed. It's like, how do you do 7 times a day? And I looked back at him and said, how are you doing 7 times a day? With all 3 meals, with the afternoon snack and bedtime milk. And I'm like, okay, you're giving 0 Cinnamate per day. You know, and so when you are an advocate for someone, and they are on a medication that you know has to be given on an empty stomach, you know has to be coordinated with meals, don't just write down the name and the dose, write down the exact times that are their schedules. And I don't necessarily mean even what's ordered, all due respect to doctors, because I know that patients and their loved ones monkey around with the times for what works. So we're not dealing with the ideal, we're not dealing with whatever, we're dealing with reality. You write down the names of all the medications, you write down the dosage that they currently are taking, and you write down the exact time as to when they are to be taken. And then at the very bottom of the page, you write down what happens if they don't get it. If these meds are not given at these times, he will freeze. He will not be able to speak. He will not be able to do this. So that then, here we're in a car accident. Hope it's not going to happen today. Please, not until I get home. Anyway, but if it does happen and you wind up in the emergency room and they say, do you have a medication list? Oh, what you have with them is all the information that they need. You have been the messenger telling them exactly what the person cannot advocate for themselves as to how to be, just going back to our goals again, the most on time. Recently, I was talking to a gentleman whose wife was in the emergency room with a fractured pelvis. She went 14 hours without getting her Cinnamate, so now she was having tremors with a fractured pelvis. I cannot even imagine the pain level that would go through with that. And he kept talking to the nurse that was right there, and obviously they had to have had a shift change, but it's like, no, you can't stop with that. They actually made her situation worse because they neglected her. So by having that piece of paper that you have, the medication list, and you have it written down, so you're not trying to come up with off the top of your head, because I tell you, when advocates are stressed out and they're feeling like this, you're not going to remember all the medications. It's going to be really hard to recall, because you're going to be stressed out too if they're sick. You're not going to be wanting to be thinking about things rationally, so you have it written down. You have that taken with you. And then in communicating, so you've got things in hand, then you use the word trust, or you use the word neglect. If you're not getting things followed by what you have given them, this is the plan. This is what needs to happen for this person's dignity. And if they don't provide it, you can tell them, you are neglecting my husband. You are neglecting my dad. You are whatever, and use those words. Now, what you don't want to do, actually, I'm getting a little bit ahead of myself, maybe. No, I'm on right with you. I'm behind me. That's okay. So anyway, so you do want to also show that assertiveness, because you want dignity for your loved one. You demonstrate dignity yourself. So how do you do that? In other words, as much as you would like to be profane or whatever, or spit, that's the last thing in the world that will really be helpful to you. You want to demonstrate dignity by showing that, hey, I'm going to tell you what's not working. But if you do use communication that is profane or out of control, they lose trust with you. Trust needs to be a two-way street. You demonstrate it, you demonstrate dignity. And you also are prepared for educational resources for yourself, or be prepared to let them know where they can get educational resources. I assure you that Michigan Parkinson's Foundation wants to know if there are providers out there that need education. You can be that messenger and say, you know, I really am concerned about your staff. People who are dealing with assisted livings or wherever that need education about a person with Parkinson's, the chances are you're not the only one there that they need to know the vital information. So be prepared to offer where healthcare providers can get education so they can properly meet the needs of their patients or people that they're taking care of. So here again, are we right? Okay. Here again, so we have a written plan about the medications, the times, everything that you're going on. You keep that with you all the time, and it's very important communicating with other doctors, because a lot of times a person doesn't only have one, they may have 4. So communicating as a health advocate to make sure that all your doctors are on the same page, because you don't want this doctor over here ordering something that's going to, the side effects of that medication actually causes Parkinson's symptoms. So it's vital to make sure that you're always communicating and that they have all that information. The other thing is, so okay, now we do have a lot of team members here, but it doesn't work so well if you talk this team member and they're talking this team member. You want fluent communication. So if you have a problem with an occupational therapist needs to come at a certain time, they need to know that. They need to know when is the best on time for working with people. They need to be able to follow through again because you want the most on time for your loved one, so you need to communicate when that is. And the other thing is here again, if a team member won't listen, well, then that's when you either ask, may I talk to your supervisor, or you do something in writing so that you know you can't just let it go. I did have someone tell me yesterday that they were a little concerned as to whether or not, gee, if I go over somebody's head, is there going to be a reverberation? Well, if you let the problem stay, it's not a solution. If you let neglect continue to happen, if you continue to not trust, that's not a solution at all. So if you do speak up on behalf of your loved one and you go over someone's head and you meet with them and you follow the chain of commands, you have stepped forward, and that is nothing to be ashamed of. You have been the messenger that you need to be, and that's for yourself or if your loved one has Parkinson's. So here we are back with, so how do we do this? Again, we talked about teaching, constantly explaining to other people, do you understand why my loved one needs to have medications at these times? Do you understand why this needs to happen? Oh, at the bottom of the page that you have documented, he will freeze and not be able to dress himself. A lot of nursing care staff, want to have medications at certain times, not realizing that if they change the times in their own mind to fit what it is for that individual and go by the individual schedule, and the individual can care for themselves, that actually results in less nursing care needed. So they need to realize that. And also, in this word of team, ears for listening, you need to hear what they're saying too. So sometimes it's easy to be defensive. No nurses understand Parkinson's. Well, maybe they do, and they just don't understand something else. So a big part of communicating is also being willing to listen to what else is going on. And always assessing what's the situation now, how much are things fitting together, how things need to improve. And just like Nancy had pointed on before, that there are times that as things progress, things change, and you have to be able to be willing to realize that something else needs to change. Is it time to talk to the doctor about medications and things? Is it time for physical therapy again or whatever? And always about managing stress. It's not just the stress of the person with Parkinson's, but again, just like what Nancy was talking about, stress for the advocate. The advocate is stressed. Well, what about stress management? Well, the thing is that if an advocate doesn't take care of themselves and they have someone that they're caring for, then you almost have to have a plan B, because who is going to care for your loved one if you're not there to be able to do it? You have to take that into consideration. And there are so many tools out there for practical stress management. I'm not going to go there at this point in time. But item number 3 is something that is so vital. And here Nancy had mentioned before that everybody's got a calendar, and I have found this to be true. Calendars out there, I'm sure. Anyway, what you need to do with stress management is put it on the calendar just like you would any other appointment. On this day, I'm going to get together for tea. On that day, I'm going to go shopping for nothing. And you treat it like an appointment. Or for the male caregivers, Monday night football. I remember one gentleman, that's all he wanted in a week. He would take care of his wife. The other 6 days, all he wanted was to watch Monday night football. We made arrangements for someone to come into their house so she would be fine, so he could go somewhere and watch Monday night football. That was great that he spoke up like that. Too bad about the end results of the games, but anyway, being able to actually do the stress management does take a little bit of effort, and you have to be willing to follow through to take care of yourself. So on that big calendar with all of your schedules, what you do is you write in the times as to when you're going to do what for yourself, and you treat it like an appointment. You are taking care of yourself. You're advocating not only for the person that you're caring for, but you're managing your own stress as well. And then I always mention the word breathe, because for stressed out caregivers, there's 2 ways to breathe, okay? There's the one you feel like breathing, or there's the okay? And again, Nancy mentioned more about resources, et cetera. And there's so much out there, and I think that Laura's going to go into a little bit more detail about that, yes, et cetera. So I'm not going to go there with that. If you do have any other questions or things, my email is up on the air, on the wall, whatever, feel free to call. Otherwise, does anyone have any questions?
So we had one question here that I think you guys started to answer about compliance with meds when people are hospitalized. If you have questions, can you hold up the card and I'll...
How to handle a hospital. Yes. So handling medications, if you have the copy with you in your hand when you take it in there, make sure that you don't actually lose what you're holding on to. Tell them, you can please make a copy of this so that you still have it in your hand 2 hours later when the next person comes in and says, no, nobody got it. So don't let go of that. Make sure to keep track of that and everything. But the... Uh-huh.
They take the list in PR, we have to go over it, there's no list. It happens all the time.
They don't bring in a list? Yes.
And we have to go through over the med list when they come up with a floor. The ER takes it, they don't update it,
Yeah.
they keep the list and we never get it.
Well, but does the person actually say you can only have a copy of this? Or, I mean, that's where I think an advocate needs to really understand that if you hand something over, it's likely that you're not going to see it again. I believe that to be true. So I think that what you need to do is actually tell them that I need to keep this in my hand. Please make a copy, because I want to make sure that it does get to the floor and everything. But make sure, and if it doesn't come back right away, keep asking till you get it. And the other thing is that you need to use the words, and this happens all the time, so sorry to say, but if a person really is not meeting the needs of your loved one, don't stop with that. Go, if you're in the emergency room, go out in the hallway and say, I need to talk to someone else, or I need to talk to a supervisor, and you just don't let it go. It's not okay. And it's hard to say that, but if all of it fails and it didn't happen at the time, I wouldn't let it go even then. I would write a letter, a post-op, or if you want to send it to me, I'll write it, and say your staff needs education because you neglected this patient, and use those terms, trust and neglect. They are speaking terms. Yep. You have another one?
Yeah, there's a couple.
May I ask one?
Yes.
Concerning my question. The pharmacy does not carry all of the
Yes.
exact drugs that my wife needs because she can't take this generic or this one or
Right.
whatever. And they have a fit.
What,
They're the
Laura?
pharmacist in control.
Yeah.
Go
What?
over them.
No.
They're there.
Here's what you do, and this is not being videotaped at this, no, I realize it. Here's what you do. When you're going into the hospital, and you're not going to carry all your medications with you all the time, so that's not going to happen with an accident. But if someone's going into the hospital and you bring some with you and keep them, okay? Now, the ones that are labeled, the box, they're going to have to take to the pharmacy and verify it, and it takes some time. However, if you keep your own little pill minder for a week or for a day in your own pocket, sometimes it's easier to ask for forgiveness than permission. Now, no health department will hear me say that and say, excuse me, she's still licensed. I mean, that's breaking rules, essentially. But the thing is, we're dealing with reality here. And so what I usually tell people is to keep some with you. Now, if you do give a dose of one of your medications to your wife, make sure to tell them, by the way, we waited so long, she had to have this, I had one with me, I gave it to her. Do let them know so that she doesn't wind up getting overdosed with something. But especially if they're medications that are hard to get, and a lot of medications are not on individual hospital pharmacies, that's not unusual. But bring them with you. They will say, in order for them to dispense meds, it's a rule that they have to actually go and have a pharmacist verify that the medications are accurate for them to administer, okay? But if you, or we're wrapping up. Oh dear, okay. But does that answer your question?
I feel sorry for the foreigners because my wife takes 8 separate times. That does not fit in with the computer and the boss.
Yes.
And all that.
Okay.
So I stay 24 hours.
Okay. Yeah. Well, I thank you for doing that. The thing is that your wife is a person, and she deserves to be treated as a person, and we don't all fit in boxes. And nurses on the floor, I know, are busy. I remember those days. I don't have any disrespect for that side of it either. But the bottom line is that she's still a person, and good for you for doing that and advocating for your wife. So, yeah, that's tough. That's tough. But, thank you. Yeah.